We tend to think of ourselves as humans, but this is not only partly true. We are composed of trillions of cells, but we are also made of trillions of microorganisms. These organisms cover our entire skin and gut that help us digest the food and protect us. But some cases harm us and bring about suffering to human life. So humans discovered antimicrobials. Antimicrobials, including antibiotics, antivirals, antifungals, and antiparasitics, are medicines used to prevent and treat infections in humans, animals, and in plants. As the world has evolutionized, these organisms have changed their form, therefore causing resistance. Antimicrobial resistance occurs when bacteria, viruses, fungi, and parasites change over time and no longer respond to medicines, making infections harder to treat and increasing the risk of disease spread, severe illness, and even death. As a result of drug resistance, antibiotics and other antimicrobial medicines become ineffective and infections become increasingly difficult or impossible to treat. Antibiotics are becoming increasingly ineffective as drug resistance spreads globally, leading to more difficult to treat infections and death. New antibacterials are urgently needed. Statistically speaking, antimicrobial resistance causes an estimated 700,000 deaths annually worldwide, and every country is potentially effective. If not properly addressed, the number could grow to 10 million per year by 2050. A recent UN report warned that the threat of AMR can be a global health crisis that could lead to 10 million deaths every year by 2050. Pakistan is the sixth most populous country in the world, which is expected to rise to fourth by place 2050. According to different research and studies, it is projected that AMR could cost from $300 billion to more than $1 trillion annually by 2050 worldwide. High costs associated with expensive and intensive treatments and escalation in resource utilization are the direct monetary effects of AMR on healthcare. There is an ongoing research on the causes of AMR, but much attention is focused on the improper use of antimicrobials. There is increasing evidence that medicine quality is another significant factor. Medicines with a lower dose of the active ingredient can lead to resistance. There are many microbes that are resistant to these antimicrobials, which include methicillin-resistant Staphylococcus aureus, vancomycin-resistant Enterococcus, multi-drug-resistant Mycobacterium tuberculosis, carbapenem-resistant Enterobacteriaceae, gut bacteria. Candida auris, one of the most common invasive fungal infections, is already widespread with increasing resistance reported to fluconazole. There is a need to understand and control of AMR. AMR is a complex problem that requires a united multi-sectora. In this regard, we find a board or a committee that can resolve this huge problem. Globally, countries committed to the framework set out in the Global Action Plan 1 in 2015. During 2015, World Health Assembly and other developmental authorities implemented some action plans. Prior to the endorsement of GAP in global efforts to contain AMR, including the WHO strategy for the containment of antimicrobial resistance developed in 2001, which provides a framework of intervention to slow the emergence and reduce the spread of AMR. The motive of this global action plan was to improve awareness and understanding of AMR, the knowledge and evidence base through surveillance and research, the incidence of infection through effective sanitation, hygiene, and infection prevention measures, optimizing the use of antimicrobial medicines in human and animal health. The progress has been slow. Only 61 countries have enrolled in WHO's class surveillance system compared to the 105 countries who report having a surveillance system in place nationally. 43 countries reported having no AMR surveillance system for humans. Countries in these regions could be supported to improve their surveillance capacity, as resistance that emerges in these regions is likely to spread quickly to other regions. Despite the substantial progress that has been achieved in fulfilling the Global Action Plan and containing antimicrobial resistance in country level, there is still much needed to be done. And what needs to be done is still a question.